Yes, good afternoon to all. Good afternoon to everyone. We have started a chapter already, right? Reproductive health we have been seeing. In that we have started what? Contraceptive methods, isn't it? We have started what? Contraceptive methods. His voice is clear? Yes. Right. So in the last class, we have seen about contraceptive methods, isn't it? Contraceptive methods. Contraceptive methods. Contraceptive methods we have seen, right? Under that, first, what type of contraceptive method we have seen? Natural method. Natural method. Contraceptive methods we have seen. The first type of contraceptive method is what? Natural method. Natural method. Under natural method. Under natural method. Under natural method, what we have discussed? We have discussed three subheadings, right? The first one is what? Periodic abstinence. Periodic abstinence. Abstinence. Periodic abstinence. And the other one is what? Coitus interruptus. Coitus interruptus. Coitus interruptus or withdrawal. Or withdrawal. Or withdrawal, isn't it? Coitus interruptus or withdrawal. And third one, what we have seen? Lactational. 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 Can you see? Lactational amenorrhea. Lactational amenorrhea, isn't it? So in the last class, we have seen about this, right? So what is that? Contraceptive methods are there. Various types of contraceptive methods are there, right? So which is the fertile period in the menstrual cycle? Which days of menstrual cycle are considered as the fertile period, which if that time coitus is taken place, it leads to conception? What is the time? What is the period we call it as? 14th day. Okay, right. Still, which period is considered as an ideal period? Very good. 15 to 17. 15 to 17 is ideal. Already 14 is over, no? 10 to 17, right? 10 to 17. Under these we have discussed. What we have discussed? At 10 to 17, right? The couple is going to abstain, right? They are going to be away from the coitus or copulation at particular time. At particular time. So these will be the best method for the contraception, right? Best method for contraception is periodic abstinence, because they're being away from each other for during what? Fertile period. Fertile period. Fertile period of the menstrual cycle. Fertile period of the menstrual cycle, isn't it? Periodic abstinence. And coitus interruptus or withdrawal, I said most amount of failure is this one. This contraception is what? It is not that much success. It is not that much success. Clear? The male partner is going to withdraw his penis from the vagina before ejaculation, so as to prevent what? Insemination. That is about coitus interruptus or withdrawal. And lactational amenorrhea. What is that? Lactational amenorrhea. Lactational amenorrhea. What is lactational amenorrhea? Right? During intense lactation. During intense lactation. Lactational amenorrhea. Lactational amenorrhea. During intense lactation, what happens? The menstrual cycle and the ovulation is going to stop. It is called as lactational amenorrhea. Lactational amenorrhea. What is the effect of lactational amenorrhea? I mean, how much time does it going to occur? Lactational amenorrhea. What is the effective time period for lactational amenorrhea? Yes, right. Very good. Very good. Then still very good. That is 6 months, followed by parturition, followed by AB baat bolna, followed by parturition up to 6 months. What? Lactational amenorrhea. Amenorrhea का मतलब क्या है? Lack, absence of menstrual cycle. Absence of menstrual cycle. Then next one. Next type of contraceptive method is what? Barrier method. Right? Barrier methods. Barrier methods, right? Barrier methods. This is natural method. Okay, next one is what? Barrier method. What is the main principle? Right. What is the main? Next one is what? Barrier method. What is the main principle of barrier method? The main principle of barrier method is what? To prevent the physical meeting of sperm and ovum. Ovum and sperm. Ovum and sperm meeting is prevented. Preventing what we are preventing? Preventing the meeting of, or preventing the meeting of what? Ovum and sperm physically. They're not going to get meet because we are using some kind of barriers, right? So what is the main principle? Right, that's it. Fertilization is not going to take place, right? So barrier method principle kya hai? We are going to prevent the physical meeting of the ovum and sperm. That is called barrier method. So there are two types of barriers are there, right? For different for males and females, we have the barriers, males and as well as females. Males and females, we have, for both the genders we have barriers. For males we use condoms, right? Condoms are the barriers in the males, right? They are the most famous type brand of condom is what? Nirod is a famous brand of male what? Condom. And it is made up of, it is made up of it is made up of thin rubber. It is made up of thin rubber or latex. It is made up of what? Thin rubber or latex. Clear ma? Can you see, right? Okay, right. So what's I'm saying here? Barrier method, both males and females they have. In males we use condoms, right? The famous brand is what? Nirod. It is made up of thin rubber or latex, and these condom is going to cover the penis. Cover the penis. Cover the penis. That is copulatory organ. That is what? Copulatory organ. Condom is going to cover what? Copulatory organ, right? Next, in females we call femidome. Female condom is called femidome or femishield or fem, simply FEM, femidome. The female condom is called as femidome or FEM or female shield. Clear? Right. So here it is made up of polyurethane. polyurethane or rubber, or rubber. It covers, it covers, it covers vagina and cervix, vagina and cervix, vagina and cervix. Clear? Barriers, right? The main principle of barrier is going to avoid the meeting, the physical meeting of the ovum and sperm, right? So these are about the barriers of both male and female, both male and female. They have other benefits, like these condoms are going to give both male and female condoms are going to give additional protection. They are going to give they're going to give additional protection, additional protection. They're going to give what? Additional protection from STDs, sexually transmitted diseases. They're going to give protection from what? Sexually transmitted diseases or sexually transmitted infections. Sexually transmitted diseases or sexually transmitted infections, a additional benefit is being given by the barrier methods, that is both the male and female condoms. And these are going to be used just before the coitus, just before the coitus they're going to be used. And it is it is going to be what? uh, Privacy in using, privacy in using, isn't it? Privacy in using. And it is disposable, it is disposable, disposable, right? It is not reusable. These are non-reusable, right? They are going to be used before coitus. Why they are using? To prevent conception. Why they are using? To prevent conception, to prevent conception. Conception means attaining pregnancy. To prevent pregnancy, they are going to what? They're going to cover their external genitalia, that is what? Penis and vagina, and what? Cervix is going to be covered. Okay. From here you did not find, right? I'll write. Okay. So additional protection kya hai? Additional protection is what? STDs, sexually transmitted diseases, and sexually transmitted infection. Sexually transmitted diseases and sexually transmitted infections are not going to be occurred. Why? Because in the barrier method, there is no what? The fluid, the body fluids are not going to come in contact, isn't it? Body fluid, because the penis is being covered similarly, so that what happened? So that there won't be any kind of what? Transmission of body fluids is going to be seen, so that there is no transmission of sexual transmitted diseases and sexual transmitted infections. And when they are going to be used? They are going to be used before coitus, and it is self we can use by our own, privacy in using, and disposal in nature. And these are not reusable. These are not reusable. Why we are using? To prevent conception, right? Besides these, in females there are other barriers are there, like in females there are other barriers are there, like cervical caps, cervical caps, and walls, cervical caps, walls, and diaphragms, diaphragms, right? These are the, these are also barriers. These are also the barriers which are introduced into the female genital tract, which are introduced into female genital tract, female genital tract, to cover the cervix, to cover the cervix, to cover the cervix. Clear? What I'm saying here, besides that femido, in females, there are other, these are what? Reusable barriers. Reusable. These are what? Reusable barriers. Cervical caps, walls, diaphragms, right? These are what? Reusable barriers which are introduced or which are placed into the female genital tract to cover the cervix, so that what happens here, the cervix is covered so that it does not allow the entry of any sperm into the uterus. Clear ma? We have seen already. See here, this is the uterus, right? This is the uterus. This is the uterus. And this is the uterus. And this narrow part is what? Assume that cervix. Narrow part is cervix. So here they are going to be placed like this. They're going to be placed like this. They're going to be placed like this. So that what happens? There won't be any kind of movement of sperms into the uterus. Clear? So cervical caps, walls, diaphragms, these are made up of rubber. They are made up of what? They are also made up of rubber, and they are reusable. They are reusable and self-inserted. They are also self-inserted. Self-inserted. Self-inserted by the user. By the user, it will be self-inserted. And besides this, there are some other creams are there, like spermicidal creams, spermicide, like spermicide. Spermicide means what? The chemicals which are going to kill, right? They're called, which kill the sperms are called spermicidal. Spermicidal creams, jellies, okay, jellies, foams, jellies, foams are used along with this one. Along with, for example, this is the cervical cap. Assume that this is the cervical cap. The cervical cap, if it is coated with any kind of spermicidal cream or jelly, it is going to be act as effective contraceptive. Clear what I'm saying? Along with these, if you use this one among these, it is going to become effective contraceptive method. Effective contraceptive method. Spermicidal creams, jellies, and foams are going to be used along with these cervical caps or walls and diaphragms, so that they are going to be act as effective contraceptive method. Effective contraceptive method. Therefore, this is called as barrier method of contraception. Clear? Is this clear? Barrier method of contraception. What is contraception? Contraception means to avoid pregnancy. Why to avoid pregnancy? To reduce the what? The population growth. To reduce the population growth, right? So that, and moreover, when they are wish to have a child, then they're going to have what? They're going to reverse this one. Clear? So barrier method. In exam, they will ask like this: what? Cervical caps and walls and diaphragms are example of barrier method, right? They're going to ask the questions in this way only. Any doubts so far? Yes, is this clear? Is this clear, ma? Lower part is not visible. Okay, up to here, okay, right? From here after, I'll maintain up to here only. Yes, no one is answering. Yes, cream also comes under barriers. Okay, cream also comes under barrier only. Right, cream also comes under barrier only. Clear? This is about barrier method. Cervical caps, walls, diaphragms are used along. If these are used along with these, right, these are not going to give protection against. Can you say These are cervical caps, walls, and diaphragms. They are not going to give protection against what? STDs, sexually transmitted diseases, because they are present inside. They're covering the cervix. They're not covering the vagina. So what happens here? If the male is without any kind of barrier method, then there may be a chance of mixing the body fluids, which leads to what? Transmission of sexually transmitted diseases. This method is called as barrier method. This method is called barrier method. Next, IUDs. IUDs. Next one is what? IUDs. IUDs. It stands for intrauterine devices. Intrauterine devices. IUD stands for what? Intrauterine devices. What does it mean? Where they are present? Intra means what? Inside. Intra means what? Inside. Uterine means uterus. So intrauterine devices. There are some devices which are going to place inside the uterus, which is going to help in the contraception. Which is going to help in the contraception. This is the most effective type of contraceptive method. What is this? This is the most effective method of contraceptive method, and this is called ideal contraceptive method, which is being used in the females who want gap, or who wants delay the pregnancy. Clear what I'm saying? IUDs means what? Intrauterine devices. They are placed in the uterus, right? This is a most efficient efficient contraceptive method, right? Most efficient and most ideal contraceptive, most ideal contraceptive. For whom it is most ideal? For females, for females, for females who wants to delay the pregnancy, to delay pregnancy, to delay pregnancy, and as well to delay pregnancy, and as well to have a space between children, between one pregnancy to other pregnancy, to have a space between children, or between one pregnancy to the other pregnancy. The best method of contraception is what? Intrauterine devices. And the most widely used contraception in India is IUD only. Most widely used most widely used contraception, most widely used contraception in India is what? Intrauterine devices. Clear, ma? What I'm saying, I did not explain anything about IUD. Just I'm saying the importance. IUD stands for what? Intrauterine devices. What does it mean? There are some devices which are going to place in the uterus, right? They're called intrauterine devices. What is the function of these? These are the most ideal contraceptive for females to what? To delay the pregnancy and to have space in children, right? And it is the most widely accepted, most widely used type of contraception is intrauterine devices, right? So here, what is required? The doctors are going to be doctors are going to place these IUDs into the uterus through the vagina, isn't it? So for example, see here, this is the uterus. Can you see? No. Right? This is the uterus. This is what? Uterus we are trying to. uterus, right? So here what happens? This is the, assume that this is the vagina, and this is the vagina, and this is the cervix. So here, with the through the vagina, the doctors are going to insert. The doctors are going to insert some kind of IUDs into the uterus. See here, this is called copper T. It is called copper T. They're going to insert they're going to insert IUDs into the uterus through vagina. Who are going to insert here? The doctors. Doctors are going to do what? Insert various kinds of IUDs. And even expert nurse also, even expert nurse also performs what? uh, IUDs. They're going to place the IUDs. They're going to place the IUDs. Now, there are three types of IUDs are there. The first one is called non-medicated IUDs. Non-medicated IUD. Non-medicated. Non. Can you see? What is the first one? Non-medicated. Non-medicated IUD. Non-medicated IUD. What is the example here? The example is what? Lippies loop. Lippies loop. Lippies loop is an example for non-medicated IUD. Non-medicated IUD is what? Lippies loop. And second one is copper releasing IUDs. Copper releasing IUDs. Copper releasing IUDs. Second one is what? Copper releasing IUD. Right? So these copper releasing IUDs are different types, like copper T, Cu7, copper 7, multi-load 375, multi-load 375, multi-load 375 are the examples of what? Copper releasing IUDs. Clear, ma? So first one is medicated IUDs. Second one is what? Copper releasing IUDs. And third one is what? Hormonal releasing IUDs. Hormonal releasing IUDs. Hormonal releasing IUDs. Hormonal releasing IUDs. Okay, three types of IUDs are there. What are that? The first one is medicated IUD. Sorry, non-medicated IUDs. Non-medicated IUD, copper releasing IUD, hormonal releasing IUD. Examples for hormonal releasing IUD is Progest Azert. Progest Azert. Progest Azert. And LNG20, Levonorgestrel 20. LNG20 and Progest Azert. Progest Azert are the examples of what? Are the examples of hormonal releasing IUDs. Clear? Is this clear? So what is the main function of IUDs? IUDs ka function, the main function of IUDs is that it helps in the, it increases the phagocytosis of sperms in the uterus. What they are doing? IUDs are increasing the phagocytosis. IUDs are increasing what? They are increasing the phagocytosis of sperm. Phagocytosis of sperm in the uterus. IUDs, what they are doing? Increasing the Levonorgestrel 20. LNG20 means what? Levonorgestrel. Levonorgestrel 20. Levonorgestrel 20. LNG stands for Levonorgestrel 20. LNG20. These LNG20 and Progest Azert what? Hormonal releasing IUDs. They're what? Hormonal releasing IUDs. Then, what is the main function? Let us talk individually later. Okay, what is non-medicated, what is copper, what is hormonal, that we'll see. First, let us see overall function. Overall function is what, first thing is what, these IUDs, they're going to make, they increase the phagocytosis. They increase what? Phagocytosis. They're going to increase phagocytosis of sperm in the uterus. In the uterus. What is phagocytosis? In the uterus. Cell eating. Cell eating. So how the phagocytosis is going to take place? Right? There are some lymphocytes are present, right? That lymphocytes are going to engulf the sperm, so that what happened, the sperm count is going, the sperm number is going to reduce. So what is the main function of IUDs? These IUDs is going to increase the phagocytosis of sperm in the uterus. Now non-medicated examples important hai yahan pe. Non-medicated IUD is an example, Lippis loop. This Lippis loop, it is called non-medicated because it doesn't have any kind of hormone, right? It has not stored any kind. It is just non-medicated, right? This Lippis loop is, it is in the form of a plastic tube, plastic tube, which is going to be in the form of double S-shaped structure. It is in the form of S-shaped structure. S-shaped structure. And the main function of these non-medicated IUDs is what? It inhibits ovulation. It inhibits implantation. It inhibits what? Implantation. How it is inhibiting implantation? Because it is going to be placed, right? Lippis loop is placed in the uterus. It is placed in the uterus, and this uterus, whenever it is placed in the this Lippis loop, whenever it is placed in the uterus, it is going to make the uterine wall very, very thin, right? For implantation, what is the ideal condition? What is the ideal condition for implantation? It should, the endometrium should be thick, so that implantation is going to take place. But here what happened? Non-medicated IUD or Lippis loop is an example of non-medicated IUD, is going to prevent implantation, prevent or inhibit implantation. It is going to prevent implantation. That is one function. That is a function of non-medicated IUD. Then what is the function of copper releasing IUDs? Copper releasing IUDs, it suppresses. What it does? It suppresses the motility of the sperm. Motility of the sperm. It's the copper ions which are released from the copper releasing IUD. The copper ions which are releasing from the copper releasing IUD is going to suppress the motility of the sperms. Then what they're going to do? They're going to suppress the motility of the sperm. Suppress the motility of the sperm. And as well, it suppresses the fertilizing ability of the sperm, right? Copper ions are doing two functions. One, it is suppressing what? It is suppressing what? Motility. Motility is very important to achieve what? To achieve. Motility is very, very important to achieve. Yes, can you answer? Why motility is important? Motility is important to achieve. Sperm motility is important to achieve. Very good, very good. Right? Sperm motility is very, very important to achieve fertilization. Appropriate answer is what? Fertilization, right? Fertilization. So what happened here? These copper ions are making them suppress the motility. That is one thing. And second thing is what? These copper ions reducing the fertility. Okay, suppresses the fertilizing capacity. Fertilizing capacity of the sperm. Fertilizing capacity of the sperm. That is about what? Copper releasing IUDs. Copper releasing IUDs. Next, hormonal releasing IUD. Hormonal releasing IUDs means they're going to release some amount of hormones. These hormonal releasing IUDs is going to is going to it is going to affect that what? Ovulation, and as well as it makes the uterus unsuitable for implantation. What they are making? These hormones, I'll write somewhere. Okay, right. Hormonal releasing IUDs, what they are doing? They are making what they are making? They are making the uterus unsuitable for implantation. Hormonal releasing IUDs are making unsuitable for implantation. For implantation. And as well, what they are making, this is the cervix, isn't it? Cervix contains cervical mucus. They're going to make the cervical mucus very thick, so that what happen? The sperms cannot penetrate. The sperms cannot penetrate through the cervix, so that they're going to retard the entry of. They're going to retard. Prevent. They're going to prevent the entry of sperm into vagina through cervix, because the mucus of the cervix is going to become thicken. Okay, and cervix is going to become hostile. Means what? It is not accepting the sperms. It is become antagonistic because of the what? Hormonal releasing IUDs. Clear? So far, what we have seen? We have seen three types. One is natural method. These you are familiar, no doubt. The second one is barrier method. In barrier method, you are familiar. I know barrier method also no issues. What happened here? You need to remember these three one. What are that? Diaphragms, cervical caps, and walls are also act as what? Barriers. These barriers are placed in the female genital tract by her own self. They're going to be placed self only just before coitus, and again after coitus also. These barriers are reusable. They are made up of rubber. They are made up of rubber, which are going to cover the cervix. Along with these along with these reusable barriers, if you are going to add spermicidal creams, jellies, and foams, the effective of contraception will be very, very high. The effective of contraception is very, very high. Clear? Yes, clear. Copper 7. Hostile means antagonistic. It's not like friendly. It's not friendly. It is hostile in nature, antagonistic in nature. It is antagonistic in nature. Cu7, copper 7, right? The name of the IUD. Name of the IUD is what? Copper 7 IUD. Copper T, because it is in the form of T shape, it is called copper T IUD. It will be in the 7th shape. That loop is what? 7. So it will be copper 7. Cu7. These will be the, many times the question will be this one. Multi-load 375. Multi-load 375 is an example of, because if they ask copper T, copper 7, we can say that it is an IUD, copper releasing IUD, but it is quite opposite to the name. There is no any such relationship with that name. So multi-load 375 is very, very important. Multi-load 375 is an example of, what is that? It's an example of what? Copper releasing IUD. Right? Examples are very, very important here. You need to practice the examples. Try to remember. That makes what? Your preparation easy. Up to here, clear? Any doubts? Yes, any doubts? Right. Take the help of the board. Okay. Try to answer. Try to answer. Right? Lippy's loop is an. 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 Right. Name, very good. Non-medicated IUD. Multi-load 375. Multi-load 375. Multi-load 375. Multi-load 375. Very good. Copper, very good. What is that? Copper releasing IUD. Right? Copper releasing IUD. Right. Okay. LNG20. LNG20 is an example of. LNG20. LNG20 is an example of. LNG20 is an example of. What is LNG20? LNG20 is an example of. Very good. Non-medicated. Good. Hormonal releasing IUD. So questions will come like this only. Right? So how copper releasing IUDs are going to affect the contraception? There are two things are there. One is what? It is going to reduce the sperm motility, and as well it is going to reduce the fertilizing capacity of the sperm, so that contraception is going to be takes place. So that contraception is going to takes place. So these IUDs are mostly widely used in India, and these are highly inserted by the females who wants a gap between from one child to other child, or who wants to delay the pregnancy, and it is reversible, and it is reversible in nature. This is what? Reversible in nature. Right? Clear? This is about what? What IUDs? Intrauterine devices. Intrauterine devices. Next. Contraceptive pills. Oral contraceptives we call. Oral contraceptives. Means what? It contains a combination. There are the hormones will be there, which are taking from outside. Synthetic hormones like progestin, progestogen, progestogen and estrogen combination hormones are going to be taken in the form of pills. In the form of pills, so that to avoid what? Conception. To avoid conception. To avoid conception, we are going to take what? Contraceptive pills or oral pills. Next one. Oral contraceptives. Oral contraceptives. Oral contraceptives. See, in these oral contraceptives, we are going to use hormones like progestogens. Progestogen. Progestogen is nothing but progesterone. Synthetically prepared progesterone is called progestogens. Okay, we can use progestogens, or we can use progestogens plus estrogen, which we call as combined pill or combination pill. Combined pill or combination pill. See what I am saying here. We are going to take a tablets. We are going to take a tablets through orally, which contain chemicals. That chemicals may be what? Progestogens. That chemical may be progestogens or progestogens plus estrogen combination. These pills are going to prevent. They are going to prevent what? Conception. Okay, they are going to prevent what? Conception. They are going to prevent conception. They are going to avoid. They are going to avoid pregnancy. They are going to avoid pregnancy. Right. So how they are going to be taken? See, for example, a menstrual cycle is going to be for how many days? 28 days, isn't it? 1 to 28 days. So these contraceptive pills should be taken continuously for 21 days. For 21 days, we need to take the contraceptive pills continuously by giving a gap of 7 days. By giving a gap of 7 days. 7 days plus 21 is what? 28 days total, right? So out of these 28 days, we need to take the what? The pill, the tablet is going to be taken continuously for 21 days, just having a gap of what? 7 days. When we need to leave these 7 days, that is, you know that. So 1 to 5, 3 to 5 days is what? Menstruation, isn't it? So 1, 2, 3, 4. Here 5 days we are going to stop taking what? This one, because during menstrual cycle, during the bleeding period, it is itself indicating is that there is no any kind of what? Conception. So during these 5 days we are going to stop. And from 6th day onwards, from the 6th day onwards, we need to start taking what? The pill. The contraceptive pill should take from 6th day to 26th day. 6th day to 26th day. 6th to 26th, how much it will become? 21 days. 21 days. And last 27 and 28 days need not to be taken. Need not to be taken. Because what happened? The fertile period is only up to 17th, right? 17th and 18th, right? Up to 26, we need to take what? Regularly. And the last 2 days also, we are going to what? We can skip the taking of the pill. So total here, how many days? 5. And in the last what? 2 days, 27 and 28. See here how you need to calculate the previous menstrual cycle 2 days, 27 and 28 of the previous cycle, and the 5 days of the cycle. Total 7 days. Total how many days? 7 days. These 7 days we need not to take what? The pill. The pill is going to be taken for 21 days continuously, right? And there is one more important contraceptive pill is there. The name of the contraceptive pill is what? Saheli. Saheli. Already we have seen, isn't it? Saheli is a contraceptive pill. Saheli. Saheli. Saheli is a contraceptive pill which is developed. It is commonly called once week a pill. Once week a pill. Once week a pill. It's commonly called as once week a pill. Means they're going to take weekly once. They're going to take weekly once. Once week a pill is what? Saheli. It was developed by CDRI. It was developed by CDRI. Central Drug Research Institute. Central Drug Research Institute. It was developed by Central Drug Research Institute located in Lucknow. Located in Lucknow. Located in Lucknow. Clear? This is the, it is going to cause very, very, very least side effects. Least side effects are going to be seen. Least side effects are going to be seen. And it is prepared from non-steroidal composition. Saheli is what? Non-steroidal composition. Non-steroidal composition. Non-steroidal composition matlab kya hai? Here it doesn't have any kind of estrogen. It doesn't have any kind of estrogen and progesterone. Estrogen and progesterone. It doesn't have any kind of estrogen and progesterone. Very, very important. Saheli once week a pill developed by CDRI Lucknow, right? And it is what? Non-steroidal in preparation, right? And what it is made up of? It is made up of centchroman. What do we call it as? Centchroman. Non-steroidal composition which contains Centchroman, right? Out of NCRT, this one, Centchroman, right? Least side effects. Okay, this is about Saheli. Clear? Did you understand about this one? 21 days pill, right? Any doubts? Is this clear? Up to here, clear? Okay. Yes, it works effectively. It works effectively. Saheli works effectively with very least side effects. You should get one doubt here. You must get one doubt. Okay, we'll see by the end of the class. Right. So progesterone and estrogen are combined pill which are going to inhibit what? Ovulation. What they are going to do? They are going to do inhibit the ovulation. This is about what? Oral contraceptives. Oral contraceptives. Oral contraceptives. Think of it. I asked, one doubt will be there on the board itself. Oral contraceptive. If you ask, I will tell. Right. Next, injections and implants. Injections and implants. Next one is what? Injections. Injections and implants. And implants. Injections and implants. Injections and implants. Injections and implants. No, we don't use during menstruation. We don't use. Good. Still very good, sir. How progesterone and estrogen will be contraceptive? Very good. This was a doubt. You must ask this doubt. What we said, progesterone is a pregnancy maintaining hormone. We said, isn't it? Progesterone is a pregnancy maintaining hormone. But here, what you are saying, by intaking of the pill which contain progesterone is going to act as contraceptive. I'm saying means here whenever clear. This is the doubt. What is the doubt, sir? You said that progesterone is a pregnancy hormone. Yes, it is helping in the pregnancy, so it is called pregnancy hormone. Then how this progesterone is going to act as a contraceptive, isn't it? How the progesterone or estrogen is going to act as a contraceptive? The reason is that whenever we are taking the progesterone and the progesterone or progesterone plus estrogen from outside, what happens here? They are going to maintain a normal level in the body. Okay, the progesterone and estrogen levels are going to be very normal in the blood. Okay, when the ovulation is taking place, when does the ovulation takes place? When does the ovulation takes place? As I said, one is what? LH and as well as FSH. Besides that, the estrogen level should also very high, right? The estrogen level should also be very high, right? So whenever we are taking from progesterogens or estrogen from outside, it is going to maintain a constant percentage of these hormones in the blood, so that what happened from the ovary, these hormones are not going to be released. When these hormones are not going to be released, what is not going to be seen? Ovulation is not going to be occurred. When ovulation is not going to be occurred, there is no fertilization and no implantation. No implantation. So what I am saying here, when we are taking progesterone or progesterone plus estrogen combination pill into our body, right? Into our body. So we are taking continuously, not one day. 21 days you are taking. 21 days you are taking means what? In your blood, you are maintaining the same composition of the progesterone and estrogen in your blood, so that what happened, there is no need of any, so the ovaries cannot release any kind of these hormones. There is no any, because information should go right, so there won't be any kind of releasing of these hormones in the blood from the ovaries, and due to this what happens, there will be no ovulation, then no fertilization, and no, when there is no ovulation, no fertilization. Clear? That is the main reason. So clearly what we need to tell here, progesterone, okay, during I mean if normal times it maintains pregnancy, and during contraceptive methods it is going to inhibit ovulation. Progesterone is going to inhibit ovulation during contraceptive methods. When you are taking artificially the progesterone or estrogen combination contraceptive outside the body. Next, injections and implants, right? There are different types. See, progestogen, progestogen injection, orals, progestogen plus estrogen plus estrogen combined. They are going to be taken in the form of injection. They are going to take in the form of injection. Clear? What is the difference between the injection and the pill? Pills are very less time, right? And pills are very less time, and pills are well accepted. Okay, that is widely accepted, and pills are widely accepted by the females. Pills are well accepted, by the females. By the females it is well accepted, and it also shows very least side effects. Shows least side effects. It causes least side effects. This is the difference. Pills for only for 1 month, isn't it? But whereas injection and implants, the period will be much longer, For example, there is an injection namely called DMPA, that is depot medoxy, progesterone acetate, depot progesterone acetate is the name of the injection, right? This injection is going to prevent the conception, for about 3 months. For about 3 months, it is going to what? It is going to be active in the blood, so that there won't be any kind of pregnancy from the time we have taken DMPA injection. This injection may be in the form of progesterone combination only, or progesterone plus estrogen combination. This is one thing. And second one, there are some implants are there. These implants are going to be inserted under the skin. They are inserted what? Under the skin. They are going to be inserted under the skin. They are going to be inserted, and these implants are going to be active more for what? 5 years. More than for 5 years they are going to be active. And similarly, pills examples, Mala D, right, and Mala B, all these are what? The examples for pills. Okay, implants are inserted under the skin, and they are in the form of matchstick, a series of matchstick like this. They are in the form of matchstick. Or they may be wear on the skin also. like a band. They're going to be wear on the skin, so that which contains progesterone and as well as estrogen loaded hormones that are going to diffuse into the blood through our skin, which is also going to act as what? Which is going to prevent conception, right? And very important that emergency contraceptive, for example, right, there is an what unprotected casual sex. Unprotected casual sex. If unprotected casual sex, there may be a chance of what? There may be a chance of conception. There may be a chance of conception. At the time, they're going to choose what? Emergency contraceptive within 72 hours. Within 72 hours, what? They may take the injection, right? They may take what? The injection, or they may take, they may insert it with what? IUDs. What we have seen earlier, that IUDs are inserted, right? For example, the IUDs are inserted so that what happened? If any kind of social evil like rape, right? In that cases, what happens? We are going to give emergency contraceptives within 72 hours. Within 72 hours. Within 72 hours, we are going to give and what? Emergency contraceptives. Clear? Right. This is about what? Oral contraceptive methods. Oral contraceptive methods. Oral contraceptive methods. Oral contraceptive methods. Now, see, all these are reversible. Whenever it depends upon the will of the users. Whenever they want to have a child at the time, it is reversible method. But the only terminal method is what? Surgical method or sterilization method. Surgical method or sterilization method. What do you call it as? Surgical method or sterilization method. Surgical method or sterilization method. See, after the class is finished, I'll post 2 photographs, right? I mean, the written part is there, which is in the form of mind map. Once you go through that, Next, the last method is what? Surgical method. Surgical method or sterilization technique or sterilization technique. Sterilization technique. Right. So surgical method or sterilization method. This is the last method, terminal method, right? This is called terminal method. For example, see here, assume that this is the male, right? So epididymis. And what is this? Vas deferens. What is this? Vas deferens. Clear? In the males, what happens here in the males? See the testis, right? Epididymis, right? And vas deferens. Vas deferens. Vas deferens. Clear? Vas deferens. So in the males, what happens? You know, we are going to do an insertion in the scrotum and going to cut. We are going to cut what? We are going to cut a part of the vas deferens and it is going to be tied. It is going to be tied, right? It is going to cut and it is going to be tied. What is that? Vas deferens. Okay, vasa differentia or vas deferens. A part of it is going to cut and remaining it is going to get tied up. Remaining it is going to what? Get tied up. So that what happens? What is being prevented here? Gamete transfer is prevented, isn't it? What is prevented? Gamete transfer. Gamete transfer. Gamete transfer is prevented. isn't it? Normally sperms which are going to be synthesized in the seminiferous tubule, and with the help of various accessory ducts, it will keep on moving, isn't it? Right? But now what happened here? There is what? A gap was formed. It cannot move, right? Gamete transfer is going to be stopped. So the surgical method in males is called as vasectomy. Vasectomy. Ectomy matlab cutting. Ectomy. Ectomy means what? Cutting. What cutting? Vasectomy is cutting. Clear? Vasectomy is a surgical or sterilization method in males is called vasectomy. Clear? Now, my question, in the vasectomized male, in the vasectomized male, in the vasectomized male, can we see sperms in the semen? Can we find sperm in the semen? Can we find sperm in the semen? Clear? What I'm asking? In the vasectomized male, can we see sperms in the, can we see? Very good. No, it cannot. It cannot, right? Why? What is the reason? Because it has got interrupted. The vas difference have cut and tied so that the sperm cannot travel to the what? To the other accessory ducts. So in the vasectomized male, only seminal plasm is released. Only seminal plasm is released. And this is what? Terminal method. It is the terminal method. And next, in females, a part of the fallopian tube, is going to get cut. Right here, the incision is made in the abdomen or through the vagina, or the incision is made in the abdominal region, and they're going to cut, right? A part of the fallopian tube is going to cut. Clear? The part of the fallopian tube is going to cut, and they're going to tie like this. They're going to tie like this, so that what happened? What's going to be seen? Same. Gamete transfer is going to be stopped, isn't it? Gamete, okay, the gamete transfer is going to be stopped. The gamete transfer is going to be stopped, since here, right, what is being cut here? Fallopian tube. So it is called as tubectomy. Tubectomy is a surgical method of sterilization, or the sterilization technique in females is called tubectomy, whereas in females is called vasectomy. Now, my question, in tubectomized females, can we see menstrual cycle or not? In the tubectomized females, can we see menstrual cycle? Can a menstrual cycle can be seen? Yes. Come on, answer. Can we see? Can we see the menstrual cycle after tubectomy? Okay, after tubectomy, can we see? Right, the answer is yes. Yes, it is going to be. Yes, because why? Answer is yes. Okay, menstrual cycle is going to be seen even after tubectomy. Because why? Isn't it? The ovary is present here. Ovary is going to release the corpus luteum hormone. Corpus luteum is not going through this, right? Hormones are not travel like this. Hormones are ductless glands. They're going to dissolve in the blood, and through their receptors, they're going to attach to the so and so part, isn't it? So here what happens, even though tubectomy happened, bleeding or menstrual cycle is going to be occurred. Only one thing is going to be prevented. What is that? Fertilization. Fertilization is going to be prevented, or transfer of gametes is going to be prevented. This method is called surgical method, or sterilization technique. And this is the best and permanent contraceptive. The rate of reversibility is very, very, very low, right? The rate of reversibility is very, very, very low. That is the reason why the doctors ask twice and thrice before they're going for tubectomy in females, isn't it? After giving birth to the two babies, the doctors will be asking whether you're going for tubectomy or not, right? 2 to 3 times they will ask, because the chances of reversibility is very, very less in this method, because it is a surgical and the permanent method. Clear, ma? This is about what? Various kinds of contraceptive methods. Various types of contraceptive methods. Right. Now what? For example, we got an idea of contraception, or contraceptive methods. Right. We cannot use whatever the contraceptive methods which we like. Right. For example, depend upon the situation. Right. We need to consult a what practitioner, right? A registered practitioner is very important, so that you're going to ask the advice, because every time we are going normally, for example, barriers, it depends. But when you're taking pills for a longer period of time, or these pills along with that any kind of infections, right? Any kind of infections or any kind of bleeding or any kind of fluid discharge, at this time we need to take the necessary suggestion and advice from the doctors, right? And we cannot prolong the usage of pills. If we keep on prolonging this, what happens? We are going to see various kinds of ill effects, like nausea, right? Nausea is going to be seen, right? Next one is what? The menstrual bleeding is going to be seen. Discontinuous bleeding is seen. Breast cancer is going to be seen. Various kinds of bleeding, and as well as various kinds of symptoms are going to be seen if we use the pills for a longer period of time. So what we need to be? We need to be in this mind. Usage is not that much significant, and you should not be unaware of usage of contraceptive. It must be used in moderate method. But one thing which is benefited is what, by usage of contraceptive methods, the population growth has got come down. The population growth was controlled a little, very, very little amount of population has got controlled by usage of various methods of contraceptive methods. Clear? My God. At the end of the class, if you tell, at the end of the class, if you tell how, how at the end of the class, not okay. Right. We'll see, because the dark marker is okay. Right. Clear? Okay. So this is about contraceptive method. So contraceptive methods में क्या क्या पढ़े थे अपन? Natural method. Natural method is of 3 types. What is that? Periodic abstinence, coitus interruptus or withdrawal, and third one is what? Third one of natural method, lactational amenorrhea. After that, what we have seen? Second type is barrier methods, both for males and females. These barriers are not reusable. that is spondome in male and femidome in females. But there are reusable barriers are there, like what? Diaphragm, cervical caps and walls. Along with these, if you are going to add the creams, spermicidal creams, foams and jellies, they're going to add what? Effective contraceptive methods. Effective contraceptive. Effective contraceptive. I will send. Okay. Saheli. Right? Saheli once week pill. Right? Clear. This is about contraceptive methods. Right? Any doubts if you have, you ask. Otherwise, we'll meet in the next class. Any doubts? In the next class, we are going to talk about MTP, medical termination of pregnancy. MTP, medical termination of pregnancy, or induced abortion or voluntary termination of a fetus still in the mother's womb is called medical termination of pregnancy. That we are going to see in the next class. Clear? Right? And tomorrow, one thing, practice the questions. Okay. And if you have any doubts, tomorrow we are going to see the doubt session. Right? Complete reproduction in human beings is the topic for your next week exam. That is on Sunday. Right? We'll meet tomorrow. Thank you all. Thank you.